Good morning, good afternoon, good evening. Welcome to the Supply Chain Risk Management Consortium, third in a series of webinars focused on non-government organization, NGOs, aligned to our Supply Chain Management Readiness Assessment tool. We're looking to create an advantage for your NGOs by using this tool, developing bottom line impacts to drive deliverables and decrease stockouts to save lives. Our assessment takes about 30 minutes to complete. We've had quite a number of folks fill out the assessment with the NGOs. So we appreciate more folks filling it out and providing you feedback on where you fit relative to the others. And all this can be aligned to an action plan. We appreciate you taking the time today to attend today's webinar on building an evolving resilient enterprise, and we hope that your family are healthy and safe. Again, this is the third of the series of webinars. We had webinars in aerospace, retail, and upcoming webinars in automotive and electronics. Again, we look forward to an interactive webinar. Please put your comments in the chat and respond to the polling questions at pollev.com, Greg Schlegel 910. It's also in the chat. My name is Jim Vries, founder and president of Enhance International Group. I will be the host of today's webinar. We also have Connor Fincham from Uphaven Group, South Africa, who will be helping us facilitate the call today. Joining us is Greg Schlegel. Greg is sharing his vast experience. He was one of the original founders of Supply Chain Risk and Resilience and former president of Apex, now ASCM. Greg, a few words?
You bet. Thanks, Jim. Pleasure to be here with you today. Thanks for attending. I'm the founder of an organization called Supply Chain Risk Management Consortium. We've been in business for 13 years. We operate in 23 countries. We'll give you a thumbnail sketch a little bit more in a couple of minutes. I've taught supply chain risk management at Lehigh University for 10 years, still teach ERM, Enterprise Risk Management, at Villanova University here in the States. Spent 8 years with IBM as a supply chain executive consultant. Spent 30 plus years, perhaps like many of you, as a supply chain practitioner for a couple of Fortune 100s. I've taught supply chain management at 4 U.S. universities during my career. And as Jim said, I've been president of the Apex organization, now coined ASCM. So welcome and thanks for attending, Jim.
Thanks, Greg. And a little bit of my background. I'm the president of Enhance International Group. We're an exchange of consultants, consulting companies, and SaaS providers, enabling your resilient enterprise. All the consultants have been vetted as best in class, all very tenured folks. EIG acts as a Swiss Army knife. Our team is dedicated to empowering your organization workforce by leveraging our partners' tenured thought leadership expertise. With that, Greg, a little bit background on
you bet.
The consortium.
Yep. Give you a thumbnail sketch. On the right side, who we are and what we do. We break out our organization into 3 pillars. We have 32 companies. That's about 1,700 risk professionals around the globe. You can see we break it out into 3 pillars. 1 is education, 2 is consulting, and 3 is a host of software as a service geared specifically towards supporting supply chain risk and resiliency journeys. On the left is what we provide. We talk about 5 areas. We have 2 online certificate courses, 1 for manufacturers, and the second is for public healthcare service organizations. We do a lot of coaching and consulting. We mentioned we have SCR&R platform solutions. Most of them are cloud-based. We have 2 online assessments. 1 we're going to talk about today, which Jim mentioned already, supply chain management online readiness and how it relates to the healthcare supply chain arena. And our newest is a prescriptive online pure risk 90-day action plan that evaluates your risk maturity, your risk appetite, and your risk culture, all mechanically using AI and ML algorithms. So that perhaps will be for another day. Back to you, Jim.
Thanks, Greg. That a little bit about EIG. We act as that Swiss Army knife in delivering self-sustaining growth. We break out things between strategy and execution is the way we look at it. So we have some of our partners that focus on strategy and others execution, and then still others of linking strategy to execution. And so we really work to help you gain your competitive advantage. This model here has two wheels. It links strategy to execution. The two wheels are connected by a chain, with strategy being the larger of the two wheels. The two geared wheels are inexplicably linked and in sync, otherwise will become derailed. Developing an agile supply chain mindset will ensure that we are successful for our journey. Since the front wheel moves at a slower rotation than the rear wheel execution, which moves at a faster rotation, a solid strategy will result in many execution rotation cycles. In summary, a strongly linked strategy to execution ecosystem results in positive momentum for your organization, its employees, customers, suppliers, and stockholders. Quoting Albert Einstein, life is like a bicycle. To keep your balance, you need to keep on moving. With that, we'll move on to the deliverables today. We're going to focus on describing how process maturity enhances your bottom line financial performance, but not only your bottom line financial performance. And we know that NGOs have very limited amount of money. So how do you optimize the money that you have to deliver on your to save lives? We want to find out which areas you can leverage your strengths so you can improve your weaknesses. And then we're going to focus on providing real live NGO case studies. We have quite a number of NGOs experience with working with NGOs, and then provide NGO best practices. With that, appreciate folks entering into the pollev.com, Greg Schlegel 910. Looks like we have a pretty eclectic crowd here focused on NGO. So thank you again for signing up and joining us today. Greg, any thoughts?
Yeah, it's great to see supply chain titles within this arena because it is supply chain. It's just not manufacturing. It's more or less service and logistics and folks who move material from point A to point B.
Thanks, Greg. With that, we'll get to the agenda. First, we'll focus on what are the compelling reasons to act in the NGO arena. Quick review of the supply chain management assessment methodology, our approach, and a deeper dive into the NGO supply chain management landscape. And then we'll get into 2 case studies using the tool with NGOs, and then leveraging your strengths in improving your customer service. We'll get into some metrics. With that, we're going to get right into the compelling reasons to act. And we're going to kick that off with what are some of the challenges you have in running an NGO. So we have sourcing, alignment, funding, transportation. We're going to revisit this at the end of this section. So we thank you for responding so quickly. And we're going to move on and recap right at the end of this section. Greg?
You bet. We thought we'd start off with a quick profile of the NGO kind of health metrics and evaluation metrics, basically coming from the World Economic Forum. This is a picture image as of March of 2020. And essentially on the left-hand side of the y-axis are the billions of US dollars in terms of investment. On the x-axis on the bottom are the years from 1990 through 2020. So appreciate the data coming from the World Economic Forum. On the top left, the legend are essentially the investors, whether it's a company and or a country. So they're color coded. What we want to get across is as of 2020, the investment rate has really increased, almost really 36% in terms of investments year over year, and you can see that just moving from 2019 to 2020. So we wanted to give you a profile of who is investing, both from a foundation company point of view and associated with countries, and it is on the rise globally. And to us, that's very encouraging. I think we actually have a compound annual growth rate on the bottom. That's pretty impressive, going through 2025 of 7%, or 55 billion US dollars. So there is money being invested to essentially drive better performance and, as Jim said, save lives. So with that, we'll move on. We thought we'd give you our profile of our healthcare experience. Jim mentioned it. We have a host of NGOs that have gone through this tool that we're going to talk about today. It's an online assessment tool for your supply chain process maturity. We've worked with over 20 NGOs, and that continues to grow. And in fact, as we speak, we're engaged in a 3-month supply chain improvement project with one of those healthcare NGOs. So we wanted to share that with you. And with that, we'll move on, talk a little bit more about the industry and supply chain disruptions. This is a profile of industries with the highest number of disruptions. This comes from friends of ours, Resolink. They are a software organization that are rating thousands of suppliers for risk and resiliency every day. When I say thousands, they have hundreds of thousands of manufacturers, facilities within their supply chain community. Then they rate them in terms of their risk level and their resiliency. And what we wanted to do was share some data we received from them in terms of the highest number of supply chain disruptions in the first half of 2023. And at the top of the list, number 1 and number 2, life sciences and healthcare. So we have a lot of work to do relative to minimizing supply chain disruptions. So with that, we'll move into something we call the trends. We wanted to share with you a couple of trends that we have seen. Also, this comes from a company called Focus International Advisory Group. And so they share information with us, and we do as well for them. Couple trends. Industry will spend probably $65 billion US on security products and services within the next 5 years. All right, all in an attempt to shore up their digital supply chains. Number 2, expected to spending to increase by at least 4.3% annually. We talked a little bit about more investment. So investment and spending a little bit different, but 4.3% annual growth, that's pretty good. Number 3, significant pressure from governments and regulatory authorities to lower the costs and deliver more affordable healthcare to all patients everywhere. Number 4, on the right, patients are demanding higher levels of service via new channels like online channels and mobile applications on your phone. Number 5, digitization of the supply chain and related technologies, such as using AI, to create new possibilities for different types of services, and again, to reduce the cost and improve delivery of meds. And then finally, number 6, digitization to them and to us, we agree, is a must. Utilizing tools like Internet of Things, RFID, predictive analytics, big data, and AI to do what? Reduce costs again, improve performance, and minimize the risk of adverse events to the patients. So currently, the industry is ranked in the bottom 20th percentile of the industry digitization index, according to McKinsey. So we all have a lot of work to do. With that, we'll turn it over to Jim.
And with that, we have a question here, and we appreciate you the feedback on what are the challenges in running an NGO. We're back to that. It sounds like funding is a big challenge. There's a lot of money out there, but getting it to the front lines still a bit of a challenge, as we ourselves are witnessing in trying to support NGOs. So the funding, the alignment to drive that funding to the organization to drive improvements is one of the greatest areas. Greg, your thoughts?
You bet. Funding is right up there at the top, folks. And then it's the distribution of the funding. And we could talk about it for hours about think of how complex a manufacturing supply chain is globally. We are normally talking regional within countries or a couple of countries, but all the elements in a supply chain end to end, even though you're not manufacturing a product, all those elements are present, including rules, regs, taxation, politics. It gets complex, folks, real quick without even talking about supply chain methodology. So we have a lot of work to do. Thanks for engaging in the question and answer. Next, we essentially are going to discuss the supply chain management assessment methodology with you. So with that, we'll move into the next slide. We thought we'd start off just giving you the genesis of the supply chain management tier 1, we call it, assessment tool. So it was born way back when in the first of a kind MBA supply chain management or supply chain risk management course at my university, Lehigh University in Pennsylvania. It was so well received over the first couple of years that we actually built it out and took it on the road. The tools, we've been operating the tool in one way, shape, or form for more than 10 years. We utilize the tool in our classrooms, our workshops, our webinars like this, and with client engagements as well. And now we've upgraded the tool within LMS, we call it a Learning Management System Platform. And I'll just give you a real quick thumbnail sketch of what you see on the left. This is the chart you receive once you go through the 92 questions. Essentially, we've taken our 30 years of SCM experience, 12 years in the risk management arena, and developed this supply chain management readiness assessment tool. It gives you 2 assessments. It assesses your supply chain process maturity. You can see the 13 tenets, and it also assesses your risk. So let's take a look. There are 13 tenets. That's, in our point of view, that makes up a good end-to-end supply chain process. The star chart's a maturity curve, actually, or maturity model depicting how mature a company's supply chain processes are. where the lower the number, the more mature the process. So the closer you are to the center of the chart, the more mature your supply chain processes are. As you go through the 92 questions of discovery, you can see in this example a company's response. That's the black line per supply chain process. Remember, the farther away the responses are from the center, the less mature that supply chain process is. Secondarily, we've developed risk levels within the maturity model. Ergo, the farther from the center, the higher the inherent risk you have for that particular supply chain process. It does not tell you supplier 22 is at risk. That's not the detail we are in at the moment. It basically is evaluating your supply chain process maturity. And based on our 35 years in the business, we give you an inherent risk, and those risks are color coded. You can see the green circle, that's low risk. From green through the orange, that's medium risk. And then if you're at what we call affectionately the red line, which is the ring of fire, if you're there or beyond, you have very immature processes and you have inherent risk. So we wanted to get you grounded on the elements of the Tier 1 assessment tool. Okay. With that, we'll move into an overall viewpoint just to give you the end-to-end profile of the platform. On the left, you see Tier 1 and Tier 2. You can consider Tier 1 as kind of a single user. Essentially, it gives you, like we showed you, gives you a profile of where are you within the maturity arena. It identifies surprises. It gives you a tenant maturity today, not what you would like to be, but your as is condition, and it drives the conversation. That's why we built it that way. Tier 2, think of it more of a division. It's still an internal type of assessment, but it takes a little bit different look, and it basically asks the question, who are you? Do you have aligned vision? Because we're talking about more than one person answering the questions. It identifies your strengths and weaknesses, and we'll go through that in a couple of minutes. And you can consider it an aligned team consensus of your maturity. On the right-hand side, we move to Tier 3, and Tier 3 and Tier 4 are what we call, you should consider them external assessments. Tier 3 kind of gives you a roadmap. We'll talk about that today. It more or less gives you a sense of where you are in your industry. So it positions your organization within the industry best-in-class arena. It asks and gives you what's important to you in terms of the tenets, which ones are important. It also asks questions and gives you charts on how satisfied are you or dissatisfied associated with your performance with that process. And it gives you a tenant prioritization plan, and it actually seeds action plans going forward. And then Tier 4, again, is more of a playbook where you wrap all the capabilities and consulting within the tiers, and it's basically giving you a playbook to do the right things, do them the right way, in the right order, and improve things like OTIF, on time and in full, which is delivery of meds to the patient, and what we call inventory turns or asset turnover. Essentially optimize the use of your existing assets in your network. So with that, we'll turn it back over to Jim.
So we have another polling question. This is more of a trivia question. If NGOs were a country, how large would the economy be in the world relative to all the other countries? Would it be the third largest, the fifth largest, eighth largest, 10th, or 12th? So look forward to your responses here. If you can't get into the platform, that's okay. You can just enter it into the chat. whether it's A, B, C, D, or E. I think it's pretty interesting to me to see how much money is going into this. We saw the dollars up in front and how much dollars are going into NGOs. And this started in right after World War II, when the UN was started. The NGOs started building up, and how significant it has been, especially in Europe and Africa. So, drum roll, I'll give you the answer. The answer is fifth largest. So pretty significant NGOs. With that, I'm going to move on to talk about the Tier 1, the Tier 1 best-in-class benchmark. And in it, we subdivide the responses into, as Greg explained before, leaders, mainstream, apprentices, and ring of fire. Again, this is a real-life output. And we can see here the yellow that this particular company or organization, I should say, NGO, is in that mainstream section. So it's probably where most of the NGOs are from a best-in-class perspective. What's interesting is to see how you compare to other NGOs, and that's a Tier 3 offering where we compare your performance relative to the other NGOs and assess that. So if you have any questions on that, please let us know. Again, the outputs are you assess your mature and immature processes, meaning which tenants are you closer to the center on versus the ones that are not. So here you can see intentional redundancies clearly, and supply purchasing are clearly towards the center. So those are the mature processes, and things like demand management and agility are those areas that we're not performing as well as we'd like to. So we want to reinforce the mature and investigate those immature processes. And then, of course, we want to address any surprises that come up. And the value proposition, of course, is to develop that action plan with you and your team to address the immature processes and gain your supply chain stakeholders alignment. And what does good look like? Really good looks like that everybody's aligned on what improvements need to be made and that you're increasing maturity over time aligned with your metrics. With that, we'll move on to some testimonials from the folks that have been taking use of the tool, as well as our courseware where that focuses on this sector. Some of the feedback that we've received from a supply chain director is the assessment tool within the course was very good experience for us to visualize our supply chain and connect the dots. The tool was a great capstone exercise to a very comprehensive and beneficial risk course. So in our course, we have the assessment. So it's a twofer, so to speak. You learn about supply chain risk and resiliency, and you get the course. And then we'll move to the bottom right. Here, this is provided with an in-depth understanding of risk and resiliency, again, referring to the course. So we like to use the assessment tool with the course, as we have many, probably hundreds of feedback from in the NGO space since we've been working in that area for quite a while. With that, just to give you an update on the our online tool that we launched about a year ago on August 1st, we're up right around 150 or so people who have completed the online assessment. We've had over 250 active users. Folks are finding it to be quite useful. Again, our number one area is actually in the government and NGOs. Those are the top two areas, followed by retail, aerospace, 3PL, distribution, electronics, automotive, oil and gas. We have over 20 different sectors identified with folks completing the survey. So we are, again, at the ready to do benchmarking comparisons, which is our Tier 3 offering. But just get in there, do this feel free to perform the assessment. And if you have any questions, don't hesitate to ask for support. With that, Greg?
Yep, you bet. We tried to get you grounded on, the tiers, the actual platform. Remember, tier 1 that we've been talking about, it is free. Remember that. That's always a good word. You can get in there and play around with it till your heart's content. So again, feel free to exercise your option and get into the free tool set tier 1. What we thought we'd do is from our 13 years in this space, this is what we would call the healthcare supply chain landscape. For those of you who are supply chain oriented, we'll start on the top with kind of the x-axis on the top, and that you can see we have 3 pillars in this landscape. On the left, we have the private sector pillar. In the middle, we have the public sector pillar. And on the right-hand side, we have the NGO sector or pillar. So when you operate in this landscape, we have 3 large-scale pillars who are not necessarily aligned with each other. On the y-axis on the left, we have, as you can see, multiple arenas where the healthcare supply chain NGO operates. All the way at the top from international, meaning country by country and continent, down through national, down through regional areas, districts, cities, large towns, small towns, rural communities, all the way down to the ultimate end user, which is the patient. So when you look at the horizontal profile and the vertical profile of this supply chain landscape for this sector, it's pretty complex environment, folks, and a lot of moving parts and a lot of, I'll say, conflicting objectives. All right. So we wanted to give you a picture image of the environment, talk a little bit about it, and then we'll move on. So I'll turn it back to Jim.
Thanks, Greg. With that, we'll talk about supply chain risks that we're seeing, that we've talked about, and this is from a United Nations Health Care Supply Chain Study, 2017. And the question is, which of the following conditions make your NGO most vulnerable to supply chain disruptions? And there are over 100 folks completing the survey, and it is done by the UN. It's a little dated, but I think these are all very familiar type things. And then what we did was we aligned them to the supply chain management readiness assessment tenets. So in the left-hand column, you see the tenets. In the next column, we're going to have the vulnerabilities, and then we're going to have the score, relative score, and we'll go in order of importance. We'll hit the top 3 and then open it up for questions for the remaining. So again, we've been talking about the uncertainties in funding and financing. That's clearly the number one, just as we identified here today. Then the next area is the diffused accountability. Who owns what, as Greg just pointed out in the chart, and the disparate conflicting country rules and regulations. Every country, every city, every town has its own regulations in this. And so what we've done is align some of the tools, and that having a good balanced framework is very important. Having good what we call sales and operations planning is also very important. How do you transform the needs of your front lines to the suppliers that are supplying the goods? How do you connect those two together is quite a big challenge, and therefore the accountability and in between the accountability issues and the regulation issues, it gets complicated very quickly. With that, there's a number of other issues, poor collaboration within the organizations, result of that, and integrated supply chain, and so forth. Greg, your thoughts on this slide?
You bet. There's enough uncertainty out there in this landscape, folks. Hopefully we've given you that insight to not scare you, but to enlighten you that there are a lot of moving parts in this landscape from a good supply chain point of view. And so we feel, as Jim went through a couple of the alignments, we feel our supply chain tenets within the tool are very nicely aligned with the healthcare supply chain issues. And we feel very confident over the years that going through the tier 1, tier 2, going through our assessment platform can absolutely improve an NGO's supply chain performance and mitigate that risk to the ultimate patient. So with that, Jim will keep moving forward.
So we want to take that one step further and introduce you to tier 2, which looks at things from the strategic perspective, the strategic meaning that 1 to 5 year window, the tactical perspective, which is the 1 to 15 or 18 month window, and the operational, which is the 1 to 45 day windows. And under each of these, you see the aligned tenets. And so we're going to move on, but we can see that our tier 2 offering helps you focus, and because with 13 tenants, you say, where do I focus? And who are the stakeholders? So each stakeholder group, you have your strategic, your upper management, all the leadership, tactical are more the general manager type folks, and the operational is the front lines. So where do you need to focus? So in taking the assessment, you can actually split it out and you'll get those results. And this is actual results. And you can see here in these results, the blue is the strategic, the red is the tactical, and the green is the operational. And in here, overall strategic is around 7, let's say. The tactical is 4.2, you see in the bottom right, and the operational is 6. So the larger the circle on the Venn diagram in the bottom right, the greater the opportunity. So in this case, the opportunity is we need help in the strategic area in those leadership type roles, balanced scorecard, and intentional redundancies, much of like what we've just discussed. And then this is an example of how you can use this tool to drill down into an action plan. So if the challenge is uncertainties in financial and diffuse accountabilities across organizations, the remedy is, of course, agreed. You're going to start with roles and responsibility. You probably get into some change management and alignment across the organization. And then from a tactical perspective, the tenet is risk mitigation planning. The challenge is a lack of interest in continued funding of projects. So the remedy is develop hard ROIs and incentives the staff to connect these projects together so there's continuity, so we don't have on and off. So what is the risk of turning on and off a program to the sustainability of the NGO's objectives? And then logistics is a challenge of poor collaboration within each company and between partners. So there's so many different entities that need to be aligned. So the remedy, of course, is to reduce unnecessary levels of supply chain complexity, improve communication vehicles. So we just need to learn how to talk together. There are so many IT solutions now with AI of having better ways to communicate across the different entities, different platforms. So there's quite a number of different things that can be done today from a technology perspective. With that, we're going to look into how many NGOs are there in Europe. This was actually pretty amazing to me when I read these stats. Is it 50,000, 70,000, 100,000, 130, or 160,000 NGOs out there? What do you think, Greg? I, of course, know the answer. Greg, what do you think?
I'll take a stab. I'll say 70,000 B.
70,000. All right. So we'll get see if there's any other responses. Uh, got a few responses in the chat, it looks like. I see one for 100,000, one for 50,000. But believe it or not, the answer is D, 130,000
Ah,
NGOs out there. And so just to think
so
that
close.
this started in 1945. So it's almost
Yeah,
coming up on, 90 years old, 80, 80, 90 years old. So
yeah.
it's been around a while, but it's just growing as we saw in Greg's original chart. It's growing. The funding is only increasing and the need is only increasing. With that, back to Greg.
Yep, you bet. Thanks, Jim. We thought we would, as we said, share with you a couple of real NGO caselets using the SCM assessment tool over time. So we have two for you. First, actual caselet. You can see on the left an actual company. You can see the tier 1, tier 2 profile that Jim and I tried to give you some grounding on. And we explained all the tenets, the 13 tenets previously in the slides. And what I want to do is go over to the right side and actually give you some calculations from this company. So first and foremost, overall, out of a tier 1 assessment, this company, we consider this NGO as a mainstream. Why? Because their overall calculation of maturity comes in at 5.5 in a scale from 0 to 10. So we consider this company a mainstream relative to supply chain process maturity. The next thing that this organization sees when they go through the tool in tier 2 is they get a strategic, tactical, and operational focus calculation. In this particular company, this organization, we consider they're the strongest. They have the strongest elements within the tactical arena. Remember, Jim mentioned blue. Tactical is red on the right-hand side, and on the left-hand side of the chart are operational elements of supply chain, or the tenets. So they seem to be strongest in the tactical side of the maturity model, and then their second is strategic, and their operational is third. And so we then put them, we pit them against their industry benchmark in quartiles. And it just so happens that this company, when we position them into their industry, are what we call followers, with a calculation of 5.3 to 5.8. And so within their industry, we consider them followers. And that's essentially what you get out of tier 1, tier 2, and then as we go in, we'll talk a little bit more about tier 3. So what does it mean for this persona, this company? What should be their supply chain priorities? We'll talk about that in a minute. This is an output from tier 3 for the same organization. All right, they went through the questions of discovery, and one of the themes in tier 3 is, how important are these tenets to you? And it's a collective. We don't just ask one person, we ask 5 to 8 to 10 execs from different disciplines within that organization. What is the most important tenet in your opinion? And as you can see, the chart goes from left to right, top to bottom. And when you start to touch that blue box there, that blue box represents a level of you are ready for supply chain management improvement. So essentially they answer the questions, how important are the tenets, and you get a collective picture. Then on the right, there's another set of questions, and those set of questions go, well, how dissatisfied might you be? How dissatisfied are you relative to the performance you're seeing within these supply chain processes? And again, you can see top down, the top are supply chain purchasing, demand, info systems, agility. Why? Because they're touching that blue box that basically says you are ready to improve this because you're not satisfied and it's very important. So net on the right-hand side, when you're done going through the questions, we essentially profile for the company the top 3 or 4 tenets based on importance and based on satisfaction or dissatisfaction. You can see in this organization, it's supply and purchasing, demand management, and agility. So essentially, when you end up coming out of tier 3 in this solution, in the assessment, essentially, it provides a prioritized plan for improvement of your supply chain. Let's take a look at what else you receive at the end of the assessment. You receive some action plans. So let's revisit. What's the persona for this particular healthcare NGO? We consider them a mainstream. That's good. We consider their strength as tactical, and we consider them within their industry as a follower. So what kind of action plan came out of the assessment? Well, there were 4 elements. Maybe you want to focus more on forward-looking issues for your supply chain management and embrace risk. Embrace new global risk management standards, maybe an ISO standard, maybe ERM, enterprise risk management, or governance risk compliance. Maybe you want to start developing a supply chain and supply chain risk and resiliency talent. Maybe you start training folks, send them to courseware and so forth. Buy a book or 2. And then finally, develop new supply chain KPIs, which are key performance indicators, and maybe key risk indicators, which we call KRIs. So essentially, coming out of the assessment, this organization began to exercise these action plans back in 2020. That's NGO company number 1. We have a second example for you. Again, the chart on the left, little different picture, a little different, little farther away from the center. All right. And so what does that mean? Let's talk about the data on the right-hand side. For this NGO going through the assessment, we consider this company as an apprentice. Why? Because their overall calculation in the chart is 7.95, and that's obviously farther away from the center of gravity, if you will, and maturity from NGO number 1. What are their strengths? At the moment, we see their strength is strategic elements or tenets. They come out at 7.73. And then you can see strategic, tactical, and operational. And then we devise industry benchmark for them. And at the moment, we consider them a laggard because they are calculated at 4.4 to essentially 8. So these folks are laggards. Again, let's take a look at the tier 3 example. In tier 3, they answered the same questions collectively. How important are the tenets? You can see a little different picture, and you can see that several of the tenets are very well positioned or touching in the middle of the blue box, which says you are ready for some improvement. On the other side of the question and answer, how dissatisfied are you? You can also see the top 3 or 4 where they are not happy with the performance. And so if you take importance and dissatisfaction, we come up with 4 top tenets to improve supply and purchasing, logistics, integrated supply chain, and supply chain processes. So this organization has a lot of work to do. What came out of the assessment? We call them apprentices relative to supply chain process maturity. Their strength at the moment is strategic. We consider them, when we position them within their industry, as affectionately known as a laggard. And then what kind of action plan came out of the assessment? Little different. Said maybe you want to focus on tactical and operational issues to kind of move forward and improve performance. You might want to embrace a new global set of standards like ISO 31000, get a framework in front of you. Maybe you want to develop what we call a risk register, kind of a computer system to codify all identified and assessed risks. And then that way everyone can collaborate and see them and mitigate them, and begin the process of developing risk mitigation. Once you codify them in a risk register, then collectively the entire organization can start to develop risk mitigation plans and enter them into the risk register and execute those plans. So pretty basic action plan for this organization, and a lot of work for them to do as well. So that concludes our 2 caselets within this sector. We wanted to share real live data with you. And with that, I'll turn it back to Jim.
So the question is, how do you leverage your strengths and improve your service, and what type of metrics are meaningful in this NGO environment? So we looked at it from, again, the strategic leadership perspective, the tactical demand management perspective, and the operational supply chain processes perspective. So for each of those tenets. So the KPIs, we have identified our customer delivery. So the question is, if we're moving from the bottom to the average performance, what kind of increase in delivery time? 1%, not a lot. Average to mainstream, 1 to 2%. Mainstream to best in class in your segment, you could get maybe a 2 to 5% increase in delivery. So what that leads to thinking is there's a lot of infrastructure that needs to be built up before you're going to get the return on your investment of driving delivery. The second area, again, tactical, OTIF, on time in full. Moving from bottom to average, you're going to get 49% increase of on time in full. Average to mainstream, you'll get 89%, and then mainstream to best in class, you'll get that 97%. So that there you'll get a lot more lifts. You'll see shipments going out more complete over time. As far as the supply chain processes are concerned, fewer stockouts than your peers. So this is a tough one. Bottom to average, you're going to get 25% fewer stockouts than your peers moving from bottom to average. Average to mainstream, 50%, and then mainstream to best in class, 80%. So all these things, again, are there and focused on getting those important materials to the doctors and to the patients to serve them as quickly as possible. So, of course, that translates into saving lives here. Greg, your thoughts?
We think these are pretty compelling benchmark data points, or almost KPIs and KRIs, to essentially drive and improve supply chain performance, as Jim said, all in an effort to essentially mitigate the risks of adverse events with the patients.
Thanks, Greg. With that, we're concluded the webinar. If you have any questions, feel free to follow up with Greg and I an email, and you can contact us through the Supply Chain Risk Management Consortium website. The link to the assessment is in the will be sent out also in the minutes. And our next webinar will be in automotive towards the end of November, right after Thanksgiving, and here in the U.S. And then our finishing up the series with electronics next year. So, Greg, any final parting thoughts before we conclude?
Yep, we hope we provided some informative insights on this. We think it's very critical global supply chain space, folks. We're convinced that improving the supply chain process maturity in this sector will ensure sustainability for NGOs around the globe, improve customer delivery of much needed critical medications to and minimize the risk of adverse events for the patients. So again, thanks for attending and all the best.
Thanks, Greg. And my closing thoughts, with that complexity of NGOs, as we discussed, it takes diligence to know what to work on first, second, and third. We understand that developing an execution strategy takes a lot of time and effort, especially in this space. The supply chain management readiness assessment accelerates your capability to arrive at these decisions faster, which will hopefully speed up that decision-making process to, again, get that medication to the front lines to save lives. Again, thank you so much for joining us today. We hope you enjoyed this webinar, and